Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am super excited about today's episode, as I am every episode. But today, what's so special is we are streaming live from Dr. Amy Beard's house in Arkansas. So super excited. We're going to be discussing nature therapy. Amy has been on our podcast at least twice before, and she specializes in functional medicine. And she's going to be talking about how important nature therapy is. We talk about sunlight and vitamin D all the time and how important that is, but it's so much more than that about why we need to get outside. So with that, I'm going to let Dr. Beard tell us about nature therapy.
Oh, goodness. Well, you can shed some light on this topic.
Yeah.
You're always outside as well, aren't you?
I try to be, yeah. And speaking of that, we're going to go for a bike ride after this and get nature therapy,
sure
right?
Are. And as you can see, we're all really close together. So this is something I talk to my patients about all the time because it is astounding to me, all the people that are not getting outside. I like 20 minutes, like walking to their car and back, and that's it. And they're wondering why they can't sleep and they feel bad. And so we have to have this discussion about how, we didn't evolve indoors, right? Under artificial lighting and recirculated air and constant same temperature. We were meant to be outside.
Yeah.
And
for sure.
So when you do that, and not that we needed to do a bunch of research on it, but there's a lot out there on the effects.
So scoot in closer.
On the effects of nature therapy or just getting outside. And so people are happier, less anxiety, less depression, better cognition, you name it. It's so good for us. And so, we, as you can see, we live on a farm. So we're outside all the time. And I can tell you personally that when I spend more time outside, I am in a better mood and I sleep better at night. Okay. Because, that constant retinal exposure to the sun helps with circadian rhythms. And you bet that's going to impact your mood when you sleep good.
Absolutely. Absolutely. Janet, you're going to say something.
I am, because I'm thinking of populations that are outside all the time. And I feel like genetically they live longer.
Mm-hmm.
I really do. I'm just thinking about even people that have jobs that are outside too, just how different it is versus somebody that is in a cube all day long.
Yes.
Well, when we think about, the things that were created in nature, whether it be the beautiful fall colors that we're seeing right now, whether it be, night versus day, we saw a lot of rivers and water driving to your house. And it's just, those things weren't created by accident. So, that means that it was created for us to enjoy it. If it wasn't created for us to enjoy, things would just be black and white.
Right.
So there's so many things, we talk about often about how important sunlight is and vitamin D production is in our skin in response to sunlight, but it's so much more than that. When we get out in nature and even get out in the sun or nature in general, there are so many neurotransmitters that are stimulated. Some of what we do know, some of what we don't know, but it definitely, when we get out and enjoy nature, it definitely makes us feel better. You want to get into the details? I'm going to put you on the spot. You want to get into the details of neurotransmitters?
There's a lot of them. And personally, and most of them are produced in your gut. Right. So, but we know that being outside, there's just so many, the smells, the sights, even the feel of the breeze on your skin, and all and you can, we can get really off into nerdy land here with frequencies and vibrations and stuff.
Well, then let's do it. Let's get nature,
nerdy. But they do. And it's a natural vibrational frequency, right? So we have, again, evolved with this type of environment. And it seems like within the last 20 years or so, we have just gone completely away from that really, really quickly. And everybody is living inside because of modern times, and our health is suffering because of it. So just think about when we get, especially out here, there's all kinds of smells because there's cows and other animals and in gardens.
And that's not a bad thing.
No, it's not. It's and think about the feelings that invokes.
Yeah.
For me, it's a very positive thing. Especially when we're out hiking or biking, it's clean, fresh air. It's not, you're not smelling all the smoke and other nasty stuff that you might get in urban areas. So, man, we could really go off on a lot of tangents on this.
Well, I think leading up to this podcast, you and I have been discussing this for a couple months now, and it just hit me when you said something about. I always think of nature. When I thought of this, I thought of the things that we see,
Mm-hmm.
The colors and things like that, and the water. But then you hit on it. It's like the sounds, the smells. I mean, we have all these senses that we get to benefit when we're out in nature, and you don't get those when you're locked up inside. I mean,
No.
the sound of running water or the like you say, the smells. So
this is epigenetics we're talking about.
Right.
This is generation after generation of these things interacting with your DNA in very positive ways, in concert together and doing things we still don't even understand.
Right.
But I know that it's good because when I have my patients get outside more, they start healing and feeling better. So there's definitely a correlation there. And I think maybe it's just spending less time on a computer or a phone is probably part of that too. Because I tell them, definitely do not take your phone outside with you. Just leave that baby back home. And just sit outside, expose your retinas to the morning, midday, evening sun. That there alone will help reset your circadian rhythms. And so people don't do that anymore. Right. And look what is happening.
Right.
Janet.
So I'm going to touch on this a little bit because I feel like we have a lot of anxiety right now in our culture. And if you go to a spa, the first thing that they do is they put on that music of running water. And, so they've touched into that one. Yeah. They've got that one right. You have the tranquil sounds, but it's all nature usually running through that. Right. And I think in order for your brain to actually calm down, sometimes we just need to have those cues from our nature because that's how we were made. And if you are out there, then I don't think you realize it, how often that we start calming down. And why that's so important is if we're not calm and we're always in that flight state, then you aren't going to repair on your tissue level and your brain level. Your brain's not going to ever get to that point where things are calming.
So, Janet, tell them about our experience when we flew into Philadelphia and stepped off the plane and was there for like 3 or 4 days a few weeks ago.
We live in a very rural area as well. So for us, and we go into the mountains and we do a lot of outside activities. So for us, this is kind of, being at peace in nature is important to us. So we're in a big city, one of the largest cities in the United States, and we didn't realize how loud it was. We actually had to tell each other to stop yelling at each other.
Right.
We're like, but it was constant horns. It was just
traffic, people
it
talking,
it was normal noises. Now, I'm not saying that this was horrible from the standpoint that people have to live, but if you never step out of it and never find that, it was never quiet. It was constant noise, and we didn't realize how we were just like, until we stepped away from it, and you actually could breathe, and you're like, okay, we don't have to yell at each other to hear each other anymore.
It's like sensory overload.
Exactly.
It really
for
was.
Me anyway.
And we didn't even realize.
No.
Well, there was, and it's not like Jen and I haven't traveled to big cities before, but Philadelphia was the probably the biggest.
Dense. Yes.
Yeah, because we've been to LA, of course.
That's
but it's so spread out,
right?
And so Philadelphia, we just felt like there were just the concentration of people, and so we were kind of overwhelmed for 3 or 4 days, but we didn't really realize it until we got back home, and we're like, Oh my gosh, it's so quiet
peace.
here.
But the people in the city, because we have had guests stay with us, relatives or friends who are from the city, like Chicago, and they come out here and it's almost freaky to them.
Yeah.
First of all, it can be quiet, but it also at certain times it can be really loud with crickets and frogs. And it would just, they're like, it's so, what is this? You know, and we're like, this is nature.
Right. I mean, to me, that's peaceful.
Yeah, to me
You know,
too.
when I hear crickets and stuff, right.
And they do say you get used to the sounds in the city because
Sure.
it's something, you know, the background noise just finally does die down. But like you said, it's for me coming from somewhere like this, it's a bit of a shock for the first few days.
Yeah. Well, I know, you know, I think that generationally speaking, we were, and not that the cities are necessarily bad, but I think it's probably good to get out of the city and get into nature therapy.
Absolutely.
And really, one thing we did notice is, like in probably pretty much any major city, is you only have to go an hour outside of the city and you're in a rural area. So
it's not hard.
No, it's not that difficult. So
and there are green spaces now in cities.
That's true.
They're trying to make an attempt to bring that to people, which is good because you can get some benefit from those green spaces, but it's nothing like getting completely out of the city.
Correct. So tell us, we're going to get some green space and some enjoy some nature therapy after our podcast. Where are we going to ride today?
So, because you told me you were bringing a certain bike, we are going to do the trails on the Arkansas River and go across the largest pedestrian bridge in the country, the Big Dam Bridge. Okay.
Awesome.
So it is massive. It's awesome. It goes right across the Arkansas River, and we'll ride along the river and towards downtown Little Rock. So you'll get to see that.
I shouldn't be excited about
that. I'm sure
that
was on your bucket list. But no, it is still, Little Rock is, it's our capital, but it's not a big city. So it's still lots and lots of trees, and it's almost like a suburban area for most big cities.
Yeah.
That's what it feels like to me anyway.
Well, I will tell you, big city is all relative, especially to somebody that's grown up in very small. I thought I grew up in a small city until you talked to Janet.
Because where did Janet grow up?
North Dakota.
Yes.
Rural North Dakota.
That's where my brother-in-law lives in Minot.
Yeah. Oh, okay. Yeah. Janet was right outside of Minot.
Yeah.
Yeah.
So where Dot's Pretzels were made.
Yes.
That place. Yes. So, my first school, though, was even smaller than Velva. I went to a little school that there was 5 kids in my kindergarten class.
Right.
And literally 5 kids. K through 12
like a homeschool co-op.
Right? K through 12, all the same building in this little town, Butte. And, of course, those were co-opted into bigger schools. But, I had the pleasure of going K through 12. And, you knew everybody and everybody knew you. And I always tell Shawn, there was absolutely no bullying allowed in our school because there was so many families. Like we had 6 in ours, which was siblings was pretty normal, but there was 3 families with 16 kids.
Oh, wow.
So you
couldn't beat up on anybody's brother or sister.
There was a sibling around the corner somewhere. And you were, so it wasn't that way. But I will say one of the things that was really neat about it is, we were very fortunate to live in a very rural place and a lot of outdoor activity, and it was super fun that way. But yeah, it was culture shock when meeting Shawn, and we went to Seattle to the university district and places like that. He's like, "You're quiet." I'm like, well,
So
isolated.
I tell a story. That's a true story. I mean, Janet was born in a house without running water.
Wow.
Yeah. I mean, so you just think of how things have changed in the last 50-some years. Yeah.
That was Paul's mom too. No electricity, no running water, and they had like 11 kids, and they made their own soap. I mean, it was, if they didn't grow it, they didn't eat it. Right?
Well, I always tell Shawn the story of going to school where I was not going to drink the milk at the school. There was something to my brain that said,
stunk.
"No,
You
it
said
doesn't
it
smell
stinks.
right." And so they wanted a little meeting with my parents, and my dad said, "No, she doesn't need to drink that milk. She doesn't like it." And that was it. It was over. And it was just like, because I had never had milk from a carton or from one of the dispensers, and I was like, "This smells wrong."
You know,
I do it.
I'm like, I feel like if we just started emulating what our grandparents did, we'd all
Right.
be a
And, you
lot
know,
better off.
I
Probably
mean,
healthier.
Jen and I talk about it a lot, but we talk about, that generation. So Janet's dad was probably a generation older than my grandparents. And some of the things
the
that,
cows.
yeah,
that's
that's
right.
awesome. Nature therapy. And Jen will tell some of the stories that, some of the things that he would say. And I mean, back then we thought he was crazy, but you look back and Janet tells a story of one time, in the 80s when there was an anti-fat, anti-dairy craze, whatever, mostly anti-fat. They were making margarine and selling margarine, how healthy it was. So Janet's mom brought home margarine. Right. And, they grew up on a dairy farm, right? And so Janet's dad ate it. Or maybe
No.
did he? No, he didn't. And he just told me, he goes, "You don't have to buy that ever again." And we think back, and of course, I drank the Kool-Aid in the 70s and 80s. I was told how bad fat was.
Right.
So even
I was a
Janet and I,
dietitian. I was telling people.
Yeah,
to eat
right.
margarine.
and even Janet and I, when we first got out of college, we were using, low-fat stuff and no butter. And of course, Janet loved butter growing up on a dairy farm. And now we realize, Janet's dad was right. It's like the butter is good for us.
We were all carb loading all the time.
Yeah, right. Just pure carbs. And we were talking about, you just look at the food pyramid and what's on the top of the food pyramid. Grains. I mean, seriously. I mean, that
was on the bottom. Remember, the foundation was all the flour and grains and all the starchy stuff.
Right. And I mean, now we realize those, Janet's dad's generation, which is my grandparents' generation, they ate bacon and eggs and they lived a very healthy life.
Yes, my grandparents did too. I mean, well into their 90s.
Yeah.
Well into their 90s.
Yeah.
And I remember being chased by my great grandmother, who was 80 at the time, in the yard. She was 80 and running me down.
I tell a story about my grandpa when we were teenagers. The grandkids, my grandparents are from Missouri, and they started a family young. So my grandma had my mom when she was 16.
Mm-hmm.
And so my grandma was a grandma when she was 36.
Yep.
So my grandpa was in his mid 50s, which at the time I thought was old, when I was like 15 or 16. And us and the cousins we're racing. It's like some kind of holiday and we're racing outside. And so here's my grandpa comes out, and we were talking, he ate bacon and eggs every breakfast. And he comes out and he starts running with us. We're like, oh yeah, we're gonna do this. We're gonna smoke this old man. And he beat us all. I mean, it was incredible. Of course, we're talking about a guy that did hard manual labor most of his life.
Right.
And
spent their time outside.
Yeah, for sure.
Gardening or what have you. They were outside because there were no TVs and cell phones and computers and other distractions to bring them inside.
Right.
Yeah. And it wasn't, honestly, his health didn't go downhill until he started
going to the doctor.
You said it. I mean, it's true.
And not working.
And that's one thing. And he said something to me that hit my brother and I. Have a twin brother, and it hit us very hard. And when my grandpa's health, his mind, first of all, started going downhill. And once he started accessing the healthcare system, it's a
nosedive.
It is.
Yeah.
And he, financially, they could have retired when he was in his early 50s. And my grandma was always bugging him to retire. Well, so finally he retires into his 60s or something, his mid 60s. And he was, we're talking about a guy that he owned his own construction company, built many roads all over the nation. And we're talking about, by the time he was in that age, I mean, he'd show up at the job site at 10 o'clock, say hi to people, take them to lunch.
Right.
And then, I mean, so
more relaxed.
Yeah. I mean,
Yeah.
and then he'd pick up a shovel once in a while and scoop some gravel.
Yeah.
I mean, I remember watching that. It was just the coolest thing. And, or he'd get in a loader and he'd start, driving a loader or whatever. And, I thought, so he came in one day into the pharmacy and he said, the worst decision I ever made was to retire. And my grandma got upset with him. She looked at him, kind of snarled at him. And I took that to heart, and his health went downhill after that.
Mm-hmm.
And that's why I say often that I'm never going to retire. As long as I can physically work, I'm never going to retire. And I don't think retire. Right.
Mm-hmm.
Our brain needs exercise just like our body does. And we're not designed to retire. If retirement is sitting around watching TV, that is not what we're designed to do.
I'll tell you one thing. My dad did shift work for 35 years, and we are glad he retired. And he is too, but he did not, he's still just as active and just involved in everything as now he has better sleep schedules, right? But he's outside every day working in the yard. He's mowing the church lawn.
Exactly.
He's going to the
staying
gym.
Active. Exactly.
He's staying active.
Yeah.
Too much YouTube, in my opinion, because I get the videos texted to me every day. So I'm like, Dad, get outside, please. Yeah.
Well, we touched on diet and exercise outside, and I feel like the generation we were just talking about, my dad used to, he had a metabolism, I thought, that was big, but if I think about it, it probably scaled around his work schedule too, of farming and ranching and things like that. But they were eating natural food, of course, but I'm sure their appetites were different.
Yes.
And part of that was probably stimulated by all the things that they were doing. But if our gut health isn't good, our overall health isn't good either. So there has to be something said about the fact that, you're outside, you're doing things, you're doing active things, your appetite increases, but you're probably making better choices too.
Well, they didn't have all the sugar that we have access to all the time now. And they were eating, like you said, bacon and eggs and butter, fat. Right. Fat and protein are very satiating. And that's why I tend to eat that way, because I don't get hungry when I do eat that way. I had bacon this morning. It's one of my favorites.
Well, right. I honestly challenge people all the time. I dare you to eat too much beef. I mean, seriously, eat too much steak. I dare you. Yeah. Or I dare you to eat too much eggs. I know Janet and I, we eat bacon and eggs often on the weekends. We don't eat breakfast a lot during the week. And, routinely I'll say, well, she's like, how many eggs do you want? And we've already got some bacon. And I'm saying, 3 eggs. And next thing I know, I can only eat 2. Mm-hmm. I mean, and an egg is only 70 calories.
Yeah, I don't even pay attention to calories. I can't tell
if you eat real calorie. Right. If you eat real food, you don't really need to. I do track my calories just because it keeps me accountable. Right. And when you eat something stupid, you put it in there, and it's like, oh my gosh, I should have done that.
Yeah, because here's the thing: because your body is not a bomb calorimeter, right? So a Coke may have, Coke and an avocado basically have the same amount of calories, but one is going to behave very differently.
Well, right, and that's a great example. So, an apple has 100 calories, a bigger apple, and a Coke has 150 calories. I dare you to eat too many apples. Yeah, I could drink 3 Cokes right away.
Oh my goodness,
and not even stop. But an apple, honestly, a big apple is all I can eat. If you eat real food, it's hard to overeat.
I know we recently just got rid of all snack foods. And we did this when we were out in Colorado. We just didn't have a whole lot of snack foods. And we both dropped 5 to 7 pounds just by getting rid of a little, the chips and stuff that sneak in, even though they're made with avocado oil or whatever.
Right.
You try to pick the healthiest junk food. But I'm like, this is just, it's not good for us. I don't feel as well when I eat it. And so we cleaned it up, and boom, weight just kind of fell off.
Yeah.
It's the inflammation, even though it's, the better quality oils, it's still junk food, and it's still not nutrient dense and what your gut health needs.
Right. It's, a good tip is if it doesn't rot, don't eat it.
True.
You know, think about the avocado. The avocado is going to rot, and those chips are not going to rot. So they're still junk food. I often challenge people, if you want to eat chips, here's how you won't eat too many chips. Make homemade potato chips.
Mhm.
I dare you to eat too many.
So
There's so much work.
You're like one chip and ooh, enjoy it.
Yeah. And there's so much work. That's the whole point, is that if we don't prepare our food, it's really easy to overeat it. So if it's in a box, you can just keep eating it.
It's just everywhere.
Yeah.
You're inundated with all the commercials for junk food. If you're in an office, there's always somebody bringing in junk. There's just junk, and a mouthful here, a mouthful there, and it really adds up. And so, yeah, like, our grandparents, everything was from scratch.
Yeah.
And even they made it. They spent all day preparing it. They didn't have any time to do anything else.
And even with the, I think preparing the food is an important part. Even with the keto craze, bread just gets hammered on, and bread is so bad. I'm a big believer. Janet is really a big believer in moderation. But when you look at like Janet's parents and their generation, they baked bread, but it was
sourdough,
and it was homemade.
It was fermented more than likely.
I mean, it was from scratch, homemade,
non-GMO.
It was just totally different. And I mean, could you overeat bread?
Oh
yeah. Butter and bread.
It's fresh out of the oven.
Yeah.
I mean, my mom, she had one day that she baked bread, and but at the same time, I think about, we did not sit in our house. We, our parents kicked us out the door.
We couldn't be in the house.
Well, we didn't have that much room, but you were constantly outside, and yes, so it would be grab and run.
Well, and
you bring it outside to you. You stay on the porch and ate.
Yeah. And that's a good point. Here's one of the problems, is that going back to nature therapy. My brother and I have talked about this before. It's like when we used to go out and we'd ride our bikes all over the neighborhood, or we'd go and play baseball outside, or whatever we would do outside in the neighborhood, we wouldn't have access to a refrigerator and a pantry. No. So you would actually go right. That's all, and sometimes drink out of the ditch, right?
Not where I live. No, we can't do that in the Delta.
Yeah, our water ran a lot faster. So
yeah, ours was dirty with who knows, all kinds of ag chemicals in it.
Yeah. So when you're outside like that, you don't have access to food, and that's one of the problems when people are inside watching TV, playing video games, whatever they're doing all day instead of that activity. One of the problems is most of it in America have basically an unlimited food source in our house. Mm-hmm. It's darn near unlimited, and that's part of the problem.
Convenience.
Absolutely.
We have lives of convenience. And, the thing about the kids, which is most concerning, I read an article, and this was a UK study, but kids were spending less time outside than prisoners. Yeah. Prisoners are allotted a certain amount of time to spend outside. The kids were getting less than 2 hours a day outside.
So
kids.
So what happens to their brain and their development? Because one of the things that you just touched on is what is it doing to them? Well, how about their imaginations? Right. I mean, when you're outside,
creativity.
Right, exactly. When you're outside, you have this space in your head where you are filling it. Not a video game, not a show, not, all that electronics, not your phone. If you think of how many hours kids spent outside daydreaming, imagination, the creativity part to me is quite frightening if you think about it. Right. And what happens as they are developing. I'm not a specialist in this, but it's very interesting to me, the differences.
Well, and you also learn a lot about physics when you're playing like we did. Right. We were, jumping ditches with bikes, jumping out of trees, falling out of trees, which I did, broke some bones. But, we were always using up our dad's old building supplies, building tree houses and just getting into all kinds of trouble. But we were learning a lot about, we were interacting with the environment and learning a lot. So stuff we probably don't even realize we were learning at the time. And kids are missing out on that completely. What is it doing to their brain?
Right. Well, that could be why we have so much anxiety too, and
Mhm.
some depression and things. I mean, I know this past couple of years has brought that on, but one of the things that we had two boys, raising them, and outdoor
Oh,
activity
wow.
keeps them out of trouble, right? Because they're
Mhm.
tired.
Yeah.
Right? I mean, but it also gives them a limit too of safe too. Like you learn your limits
Right.
in a safe way. You learn maybe that's not the best way to do this. Next time I'm going to do something different because you don't want to get hurt. I mean, just those boundaries and limits just physically, but you're doing it in an environment that is really, I mean, I'm not saying that they couldn't physically harm themselves in a way, but you want to be careful with that. But emotionally and mentally, they're learning boundaries, and they're learning things in ways that we don't really know or can't really calculate. That's good for them, especially for teenagers, because they're taking risks in an environment that's better for them.
I wrote some articles recently too. I'll say recently, a while back, about this place where they allowed kids just to be kids, and they were way up in the trees, but and nobody got hurt.
Right.
Now, and I wonder, are we being too protective with our children and not letting them be outside and exploring nature? Because they're always worried something might happen. Yes, something may happen, but typically it's not going to be horrible. There's going to be
Right.
scratches and boo-boos, maybe the occasional broken bone. But having them avoid these interactions, I think, is much more harmful in the long run.
Well, like Janet says, with looking at trying to find limits, I think especially for boys, you got to know. Well, wait a minute. I guess that didn't work. I couldn't jump that canal, so I ended up coming up
Need
short.
to have a higher ramp,
right? So either design something different, or practice
or
more. Don't do it
maybe not
again.
do that.
Right? But you got to find your limit, and I think that's what sets them up for life in general.
Mm-hmm.
And it's not just limits in physical activity, but mental activity too. It's like, what can you accomplish? Now, what do we do for boys that are, I got into a debate with somebody on social media the other day about ADHD, and I don't believe in, largely I do not believe in that diagnosis at all. I mean, if you want to, they do not lack some kind of medication. No. I mean, get outside, be active,
exactly,
exercise.
Their gut health, because I've worked with a lot of these kids, and you clean up their gut health, you get them off the phone, you get them sleeping better, and they're like a new kid.
Yeah, outside and exercise.
Get them off the food dyes and the really crappy food, and it doesn't even take that much.
No.
But the parents, it's a fight, right? They're like, oh, it's just not worth it. I'm just going to give my kids. And I'm just like, what are you talking about? This is your child and your child's brain. And this is when they're learning the most, they're just like sponges, and you're denying them because you don't want to put up the fight.
Yeah.
Over the food.
Right. And I got to think too that largely, I'm going to guess the parent probably has a bad diet also.
Probably,
usually in the case.
Absolutely. Yeah. And I see it. Some of my friends too. And I just have to keep my mouth shut.
I'm surprised. I'm surprised you keep your mouth shut.
Well, it's because they know I've already had that talk, and it's just like, you guys know what you need to do.
Right.
So.
Right. So, I mean, you touched on food, which is great, because I believe that has a lot to do. We were talking about the neurotransmitters being made in the gut. So if you're not eating right, that's bad too. But it's also, those kids they're in trouble because they're moving.
That's why they get in trouble. Yeah. Okay.
I see. And how about we channel that into letting them
play?
Yeah. So my youngest son, when he was in elementary school, I think the 5th and 6th grade, he and maybe even junior high, he's a mover. Like, he moves, and he's always been like that from the time we homeschooled him to teaching him. And he's super smart, but he got in trouble for moving. And, I think one of the problems in our culture is that we want, especially people that move, they want people to sit still. Well, maybe we need to, and I see schools that are addressing it, but maybe we need to address this in outdoor activity for
Right.
these kids. I mean, and that's one thing I will say about our youngest son. He's always been very active, but having him be active probably kept him out of a lot of trouble. And he's super smart, but
Because
you
of
know-
the environment, though. The environment
Right.
is making him be something
Right.
that is going against nature.
Right.
And so the recess time, I mean, there's some schools that don't even really have recess anymore. And I'm like, you have these kids for 8 hours a day and they can't move.
Right.
Yeah,
That makes no sense.
Yeah, many schools got rid of recess, and they got rid of PE too.
Right. Yes.
And
Like-
I mean, seriously, I mean, right. What do we need more than anything in America right now? We need to be outside. We need to be active.
And that,
Um,
and I have friends who homeschool. I had health coaches and one of them had 6 children. She homeschooled them, but it was for the morning, right? It's for like 4 hours in the morning, and the rest of the day they were learning stuff. They were outside. They were active, and these kids are the most well-behaved kids I've ever been around in my life. Because they're fed well, they do everything right. No TV, no electronics, and you can tell a marked difference between them and the ones who are not doing that.
Well,
Night and day.
yeah, we homeschooled our kids through junior high, and they were basically we were done by 11 o'clock in the morning.
Yeah.
Well,
Right.
it was a little bit later.
Yeah,
than
maybe
that,
noon.
depending on.
And then they were outside
Mhm.
doing their thing. And I always challenge people. It's like, what's when kids or adults get depressed, they go to the doctor, and what do? They give them medication.
Every
Right.
single time.
And I think all of us have dealt with depression
Mhm.
at least short term.
Yeah.
And I mean, there's many times I've I just don't feel the best, and then I go out and I just go on a hour bike ride, and gee, my depression is
Mood.
gone.
The endorphins.
Yeah,
They're
I mean, it's
wonderful
just like
things.
and dopamine and all kinds of the
Yes.
neurotransmitters. I challenge anybody to find a better drug than exercise for treating depression. Period.
I agree. Just getting outside, and you don't have to, max out your heart rate either. It's just getting outside and moving your body and exposing your, again, eyes to the sun, all the other sounds and things like that. And when you do get your heart rate up, you do produce endorphins. Those are endogenous feel good substances.
Right,
They
right.
are good for you. And it also is great for chronic pain patients.
Yeah.
You're missing out. If you're not experiencing the endogenous production of endorphins, which you get from exercise, you're missing out on some great pain control.
Absolutely.
It just works.
Janet, as we wind this podcast up, how do you want to wind it up?
Well, Shawn touched on something about my personality, and I'll throw it out to my dad and that generation, that moderation in all things, and that includes activities outside, because my husband could be there way too long, which is okay if he backs it up so he doesn't have overload with cortisol. But I feel like this is such a missing element in healthcare right now, that we've told people to stay in a corner and in a box and a petri dish is really what we've developed. And it's not a healthy one. So if you're depressed, if you have anxiety, if you're having gut issues, if you're having sleep issues, I challenge you to get outside and enjoy and make it a priority.
Yes.
I think a lot of times we say we don't have time, but it doesn't have to be the whole day. It could be
Happen in
30,
spurts.
yeah, it could be 30 minutes. It could be just, going for a walk, just to get yourself away from all the other stress, because stress causes issues with our gut and our sleep and all that. And so what a beautiful way to spend a day besides, enjoying this fall weather. So I challenge you, get outside.
Absolutely.
And Dr. Beard, how would you like to?
Wow. I don't know how I can. I mean, she nailed it. And even if you have a desk job inside, you get breaks.
Yeah.
Okay. And you need to be out. And that's what I tell my patients: on your break, get outside. Even if it's just for 5 or 10 minutes, get outside, expose yourself. Try eating your lunch outside. And if you can't do that because of the weather, get near at least a bright window with a lot of sunlight and eat it there. But you cannot just hide away in your little hole all day. It is going to wreak havoc on your health.
If anybody has any questions and wants to reach out to you, what's the best way?
Probably visit my website, because then you'll get all the information you need.
And what is your website?
It's simply amybeardmd.com.
That's easy enough.
Yes.
So, well, thank you, listeners and viewers, for tuning in. Hopefully you learned as much as I did on this podcast. I always love having guests on like Dr. Beard because I learned so much from them. So thank you for tuning in to Health Solutions with Shawn and Janet Needham. And Monday, do not miss out. I don't know who our guest is, but it's going to, as always, it's going to be a great guest. So 12:30 to 1:30 Pacific Standard Time, tune in to our regularly scheduled podcast. So thank you all for listening and viewing today.